Scanning for a single unit restorative case is easy with the iTero Element Scanner. In this example, I will demonstrate how to include the pretreatment scan of the patient's existing anatomy that I would like the lab to replicate. There are 5 segments in the single unit case with a pretreatment scan: the opposing arch, the pretreatment scan of the arch, the bite with the patient's anatomy intact, the prepped arch with adjacent contacts, and the prepped tooth. The guidance hints will remind me of the scanning protocol for each segment. I will place the wand tip flat on the occlusal surface of the most terminal tooth, and once I have the tooth centered in the viewfinder, I will press either of the side buttons to start the scan. The blue scrolling bar in the segment indicator box shows that scanning is active. In one continuous motion, I will capture the occlusal, lingual, and buccal of the opposing arch. I only need to start and stop the scanner when I move between segments. I will use the controls on the wand or the arrows next to the segment indicator box to move between segments. The next segment is the pretreatment arch with the anatomy intact. The green background and the number 1 indicate that I am in the pretreatment segment. I will scan the occlusal, lingual, and buccal surfaces in this segment. The next segment is the bite with the patient's anatomy intact. To scan the bite, I will have the patient open, retract the cheek with the wand, and have the patient close in tight centric occlusion. Next, I will press the side button to start the scanner and in a wave-like motion move anteriorly, capturing 3 to 4 teeth and the upper and lower gingiva. After I prep the tooth, I will continue scanning. I will use the controls on the wand or the arrows next to the segment indicator box to move to the next segment, the prepped arch. I will scan the occlusal, lingual, buccal, and the adjacent contacts in this segment. The next segment is the prepped tooth. Ensuring that there is a clear, dry margin without any impingement, I will scan the occlusal, the lingual, and the buccal surfaces in this segment. If the green dot is not on the prepped tooth, I will use the touchscreen to move it to the prepped tooth. When I have captured all the required anatomy, I will tap the View icon to review the digital model in high resolution. I will review each arch individually, as well as the 2 arches in occlusion. I will use the touchscreen to rotate the model during my review. I will evaluate the prep using the occlusal clearance tool to ensure that I have sufficient room for the chosen restoration material. In this case, I see that I do not have adequate clearance, so I will adjust the prep in the patient's mouth and then use the eraser tool to adjust the digital model. First, I will tap on the eraser icon. Then, rotate the model to the buccal view. Use my finger to circle the area that I reduced. Rotate the model to ensure that I have erased the appropriate anatomy. Rescan the area to fill the area I have erased. And tap on the View icon to see the adjusted model in high resolution. When I'm satisfied with the digital model, I will send the case.